Hey everyone, my name is Nakul Gupta and I'm a body radiologist at Houston Methodist. Today we're going to talk about gout imaging with GSI. I'm going to show you how I do it. Some of the objectives of our talk will be to review some of the basic types of GSI images or image reconstructions, including virtual monoenergetic and material pair images, as well as color overlays. I'll tell you what our protocol is and what series we generate at the scanner and send to PACS. And I'll go over how I review a case and some of the pitfalls to watch out for. So going into the images here, to orient you all, we have these four viewports set up here. And on the top left is a 77 keV monoenergetic reconstruction with a soft tissue kernel. And then on the bottom two, we have a material pair here of HAP, hydroxyapatite, with urate or uric acid. This is the HAP part of that pair, and this is the urate part of that pair. And then here we have a beautiful 3D rendering with the color overlay in green, highlighting the gouty tophi. And we find that this is something that the referring physicians really love to see, and I think it plays well with showing to patients as well. So when I approach a case, I start with the soft tissue kernel and on the monoenergetic here. And what I'm looking for, as I scroll through these images is, any hyperdense structure that's, along a joint or also along a tendon. Gout will deposit along tendons. And, watch out for, don't mistake these vascular calcifications as, gout. But as I go through the image, I am looking for that. And so far, so good. And we're going to keep scrolling. And when we get to the big toe here, the hallux, we're going to see a pretty sizable lesion here. This is a hyperdense lesion at the medial aspect of the MTP joint. A good location for gout, but on a standard image here, you don't really know if this is calcium or urate, right? So what I do then is I look down here at my the HAP image and the urate image, and clearly you can see this lesion here is not bright on the HAP part of the material pair, but is extremely bright on the urate pair. So I know I'm dealing with a gouty tophus at this point. And then as you just continue scrolling, you get to the IP joint and you see another such deposit here. And same thing, it's not bright on the HAP image, but extremely bright here on the urate image. So you're dealing with gouty tophus. And you see a similar but smaller lesion on the other foot. And, one thing to be mindful of is in larger tophi especially, you can sometimes have coexistent calcification within a tophus, but you'll still see, some element of urate there to tell you that's a gouty tophus and not just purely calcified lesion. So then after I've reviewed for gout, I'll just do my standard, bone windows, review for fractures, erosions, etc. And we'll have separate bone kernel images for that. Now, as far as what we send to PACS, at our institution, we only send these two, the HAP and the urate image are the only two additional series that we send to PACS. So we do all our routine, coronal, sagittal reconstructions from the soft tissue, and bone kernels in monoenergetic. We don't do recons of these material images, just in the interest of keeping the image count manageable. We do occasionally generate these 3D rendered images, mainly, again, targeted towards the referring physicians. We find that they do like seeing these images, so we'll usually send one similar to this, like a spinning, 3D image with these tophi segmented out. Now, as far as pitfalls, I think things to look out for are, in addition to being around joint spaces, gout can deposit along tendons. So I do make sure to kind of follow the tendons and make sure there's not small deposits along tendons that I'm missing, and another artifact you might come across is what we call nail bed artifact. I'll show you that here. You can see this, the nail bed tends to sometimes come across as bright on the urate image, but not necessarily because there's actual gout in the nail. That's just how the toenail shows up. So just be mindful of that and don't overcall that. And otherwise, it's pretty straightforward. It's, again, it's just I find something hyperdense on the joint that I'm, unclear if this is calcium or urate. and then use a material basis pairs to help me decide. So to recap, I think this is a very easy application for GSI at any institution is for gout evaluation. Hopefully I showed you that today. And again, the only real pitfall is make sure to look around tendons as well as joint spaces, and don't overcall nail bed artifact as gouty deposition. And that's how I do gout imaging with GSI.